Hello everyone and welcome to another day of high yield Usmle questions. Today we'll be talking about neurology. So we have a 31-year-old male patient presented to the emergency department after hitting the head or the side of his head caused by a fall. He lost consciousness after that, but regained consciousness 10 to 15 minutes before losing consciousness again. Widely, the patient is stable. The patient also has had episodes of vomiting. Which of the following is the most likely diagnosis? So let's talk about this. So do you remember when they say the side of the head? So usually if this is the side of the head, especially in the pterion area is the weakest on the side of the bone. This is where the parietal, the frontal, the parietal, the sphenoid, and the temporal bones. So these kind of combine. This is called the pterion area. So it's really the weakest area. And so if the patient gets hit here, there's a trauma here. Right underneath it is an artery. Let's say if this is the artery, and let's say this is the dura. So this is the dura, and this is the arachnoid matter, and then we have this is the pia mater, and then under the pia mater, this is the brain. So what happens here is that once the pterion gets hit, this artery, which is called the middle meningeal artery, underneath it, it's gonna cause accumulation of this blood, and this is called epidural hematoma because it's just outside the dura. So that's why it's called epidural. And remember, it does not cross the suture lines. So this one is epidural. It is classically there is a lucid interval associated with this, and lucid interval is just, for example, the patient gets hit, loses consciousness, and then again there is improvement or lucid interval where the blood kind of start to accumulate, and that's usually lasts short amount of time, and this time where the patient kind of gains consciousness is called the lucid interval, and then it is followed by further deterioration of the patient's condition, like here loses consciousness 10 to 15 minutes after the slight improvement. So that is the lucid interval, and it's classically in epidural hematoma. So remember, this is a convex set. By convex shape, you will see a white kind of hemorrhage on a CT scan, non-contrast CT. So this will be the epidural. Remember the lucid interval, and remember the side of the head, and remember the middle meningeal artery is involved. But if you look at another hemorrhage that you need to kind of differentiate it from, and that would be let's say again, this is the dura, this is the arachnoid, and this is the pia, and then we have here is the brain. And so what happens here is that we also have some bridging veins. So if this is the subarachnoid, the bridging vein kind of come like this. This one is the skull, and so these bridging veins, when they kind of shear, they can also cause, for example, from a fall. They can also cause it can also result in. So when these veins are kind of sheared, it can cause subarachnoid, like this is the subarachnoid space hemorrhage. And remember, this on a CT, because it can cross the suture lines, it appears like this. It appears like a crescent shape. So this is biconvex, this is crescent. And remember, there is no lucid interval here. So, and usually subdural you would see in usually you will see it in old individuals, and it can be acute or chronic. Acute can result in loss of consciousness. Chronic can result in confusion and memory loss in old individuals. And the reason is because it kind of shrinks, and the brain shrinks in old age, it can actually stretch these veins, these bridging veins, and this stretch can cause rupture because they're weak, and they have weak walls. And so here, this is how, as we discussed, usually older individuals. It can also cause from fall, for also alcoholics, or anything that causes brain atrophy. So here, no, this is 31-year-old, and there is a fall, and there's also a classic lucid interval that is seen in epidural hematoma. So epidural hematoma would be the correct answer. Subarachnoid, no, usually subarachnoid, it can be ADPKD, autosomal polycystic kidney disease, where there are like aneurysms, and it can cause kind of rupture. So it can cause hypertension of patients. It can be seen, but the lucid interval is not characteristic. Intraventricular hemorrhage, usually just remember for children or infants or premature infants in the ventricular region. So if this is the ventricle, there are some vessels in the a germinal matrix, and those vessels kind of are really friable. So in a preterm infant, these can rupture and cause intraventricular hemorrhage, and they're really poor prognosis if intraventricular hemorrhage occurs. And also vitamin K deficiency, because these patients are increased risk of hemorrhage. So hope this video was clear and helpful, and if this helps, you can help supporting the channel here, link in the description. Also, if anyone requires tutoring, you can email me here. Thank you for watching.